Budget hawks have been warning us for years that the U.S. is facing an imminent debt crisis. As a share of GDP, the federal debt is its highest since 1950, and in a matter of decades, it'll shoot higher as baby boomers retire and draw down Social Security and Medicare. Here's what you may not know. The outlook has actually gotten a lot better in the last 6 or 7 years, mainly because of two things. Healthcare inflation is a lot lower, and that means things like Medicare and Medicaid won't be as expensive, and interest rates are much lower, and they're expected to stay lower than normal, even once the Fed has finished bringing interest rates back to what it considers a more appropriate level for the economy. What does this mean? It doesn't mean that we don't still have a debt problem, because we do. Entitlements like Social Security and Medicare still need to be reformed so that they don't bankrupt the country. What it does mean is that we have more time to deal with the problem, and we don't have to take an axe to the debt right away. That breathing room can be used for other priorities, such as boosting federal investment, or if it's your priority, keeping taxes low. It's a little bit of good news. The hands on the debt doomsday clock have been moved back a little bit.